In the meantime, let's quickly move on because there has been a sharp spike in the COVID cases that have been reported. And with that, the Union Health Minister Mansukh Mandavia, we are told, will be chairing a high-level virtual meeting with the state health ministers to address and to assess the situation as a sharp increase in COVID cases that have been reported. This empowered group and National Technical Advisory Group on immunization officials, we are told, will be attending this meeting. And according to the centre's morning bulletin on Thursday, India has recorded for the first time in last several weeks over 5,000 fresh cases of COVID-19 in the last 24 hours. This is the highest daily total in the last 195 days.
Our colleague Mayank is joining us on the broadcast with the details of the preparations being taken up by the Union Health Ministry. Mayank, mock drills had already been taken up by hospitals across the country, but now that we're seeing a sharp spike in the number of cases that have been reported, take us through the details of the meeting. What's expected today? Any mandatory measures likely to be put in?
Well, Pratibha, as the number of cases have gone up across the country, and in fact, in the last 24 hours, when the health bulletin came out, more than 5,000 cases were reported, and that's why Health Ministry has taken cognizance of the rising number of cases, and they will, the Union Health Minister Mansukh Mandavia will be chairing a virtual meeting with the state health ministers, where one of the most important agendas to be discussed will be the mock drill, which is scheduled to take place on 10th and 11th of April. So as soon as the cases started to rise once again, the Health Ministry had written to the states and Health Secretary in that letter emphasized on the need for mock drill, because that will allow the health to update and assess their medical infrastructure. They have all been put on alert due to rising number of cases, and the mock drill and the number of cases which are going up every day, and also the subvariants of Omicron will be impactful factor that will dominate the virtual meeting between the Health Minister Mansukh Mandavia and state health ministers. But it remains to be seen, will there be any measures such as the mask mandate or mandatory COVID appropriate behavior, or some sort of restrictions will apply, because as of now the Health Ministry seems to be no inclination to going back to the measures that were employed during the first 2 to 3 waves of COVID-19.
फिलहाल अगर मयंक हम देखें कि अभी तक जितने केसेस बढ़ते हुए नजर आ रहा है, 5,000 के ऊपर अभी पिछले 24 घंटे में अगर जिस तरह से रिपोर्ट करे गए हैं, लेकिन उतनी हॉस्पिटलाइजेशंस नहीं हो रही है। बताया जा रहा है कि तैयारियां हॉस्पिटल्स में भी चल रही है, दोबारा से जो कोविड वार्ड्स है वो रीओपन हो रहे हैं। लेकिन अभी फिलहाल अगर हम बोले कि पैनिक करने की कोई जरूरत नहीं है, लेकिन जितने सेफ्टी मेजर्स और प्रिकॉशंस हर कोई लेता था पिछले 1-2 सालों में, उनको दोबारा से उनको फॉलो करने की दोबारा जरूरत है अब।
जी देखिए, यही मेन बात है, क्योंकि कोविड अप्रोप्रिएट बिहेवियर ही सबसे इम्पोर्टेंट इशू है जो हेल्थ मिनिस्ट्री उठाना चाह रही है हेल्थ मिनिस्टर्स के साथ, जो कि स्टेट जिनके साथ वो मीटिंग करेंगे। लेकिन हाँ, एक बात साफ तौर पर सामने आ रही है कि हेल्थ मिनिस्ट्री के अभी तक जो असेसमेंट हुए उनमें सामने आया है कि ना तो ये जो बीमारी अभी आ रही है कोविड-19 की, ये ना तो ये बीमारी बहुत खतरनाक है और ना ही इससे हॉस्पिटलाइजेशन बढ़ रहा है। तो जो मेडिकल इंफ्रास्ट्रक्चर के ऊपर जो प्रेशर हमने देखा था फर्स्ट और सेकेंड वेव में कोविड-19 के, वो अभी तक नहीं देखा जा रहा है। हालांकि कोविड वार्ड स्टार्ट हुए हैं, लेकिन अभी तक कोविड वार्ड में नंबर ऑफ जो पेशेंट्स आ रहे हैं उनकी संख्या बहुत कम है, और ये एक अच्छा संकेत है देश के लिए।
Okay, all right, Mayank. So today a very crucial meeting that will be taking place. The Health Ministry has called for a meeting with the State Health Minister also being called for this meeting. Thank you for joining us with those details.